see all the advances. So apart from all the routine conventional methods that you carry out for your diagnostic process and your pulp testing and examination, we have the digital radiography, pulse oximetry, uses probe-eye camera, liquid crystal testing and laser Doppler flowmetry. Advancing in instruments is apex locator, instruments, nickel titanium, and instrumentation methods and you have your apex locators, 4th generation of the apex locators. New generation you have the which are based on dual frequency and wavelength. Instrumentation you have the super elastic mica material, so those are the advances. And like your pro taper, which have increased flexibility, different type of cleaning and shaping files, as well as your techniques, we have advances. And then the magnification and the ultrasonics are other additional things which you all nowadays hear about and are very intrigued and maybe very fascinated by this magnification use of microscopes in endodontics. So those are, we have the loops and all the procedures that we are carrying out under magnification. Use of the ultrasonic tips are very important, which we use for access opening. These are the tips which you are seeing here, ultrasonic tips which are used for the initial access openings and for your surgical procedures. And you let us move on to the advances which we have in the irrigations. You have the combination of MTAT, and we have different irrigation activation systems like your Irrisafe and Endo activator, Maxi probe, and different delivery system and agitation systems, which are briefly noted there. Obturation, we have the thermoplasticized obturation techniques, and these are very popular. And this is again in obturation, again an important question that will be asked. So you could also include from additional vertical and other methods of obturation which have been explained. You could also add additional thermoplasticized methods in that. And advances in surgical methods where the use of microscope and magnification has become very important. Use of the ultrasonic design tips for your retro end preparation. Use of different materials like your ceramic materials, MTA and biodentine for retrofilling. Your ceramic materials, we have your MTA again, which is very frequently used for repair of all the perforations as a root end filling material for epexification as well as your regenerative endodontic procedures. Lasers in endodontics, another advance which is used for disinfection procedure. Basically the application is in disinfection and in apical surgical endodontics could play a very important role. For regenerative endodontics, we have different materials and there are a lot of other things which you will read about the tissue engineering, different types of stem cells and scaffolds. Incision and drainage, what are the different type of the procedures in the endodontics? This is a little elaborate, so I am just going to skip through all of this. I have not much time. But anyway, it will be recorded, so you could be referring to it in the video. So you all know the steps. There are the incision, there is a flap reflection, different types of the flap. Then there is your osteotomy, and after you do the osteotomy, then you go to the periradicular curettage. So there after it is done, the next step what you will perform is a root end resection. Now this can be asked here, in which all cases will you do a root end resection? I have put in the indication and contraindication, and you can attempt to do the root end cavity preparation or what we also call the retrograde filling under magnification. MTA could be used, and if there are large defects, you could also place some bone graft material. Another short note could be a hemisection. It is again an endodontic surgical procedure where you are converting, or also referred to as bicuspidization.